Namaste, myself Dr. S.P. Moosath. Many parents are very concerned about the diet. They know what should be followed, what should not be followed. But the thing is, they don't know how long it should be followed. That's what, if we want to decide how long it should be followed, we should know why this has to be followed. Then only we can say how we can withdraw it from that. Because many parents are following gluten-free, casein-free diet. Means without milk, without wheat products, all those they will be following as every health worker will be advising to avoid gluten and casein. And as per my treatment point, many other things are there. We'll just think of gluten and casein. So first of all, we should know why we are saying, or health providers are saying, to avoid gluten and casein. It's only because gluten and casein is having a specialized alpha protein in that. It is very heavy to digest. So the things which are heavy to digest, when it goes inside, body will not be able to process that. So some part of the food materials will be without digested form. So that undigested food will cause impairment in the gut. That gut impairment in turn will affect the brain. This is what modern science and Ayurveda says, gut-brain theory. So the core fact of being tantrums or getting tantrums and hyperactivity is having some part of effect in our food. That's what we say, gut-brain theory. And as per the treatment protocol, we should correct the gut correction. Gut metabolism should be corrected. So when we correct the gut metabolism, we can train all kind of food activities. That's what we have seen is the people will be following gluten-free, casein-free, GFCF diets more than 3 or 4 years. In the 5th year, if they start consuming that, again the issue will be there because we have not treated the basic cause for that. So after correcting the basic cause, I am damn sure we can introduce each and every item, and it is not same for every kid. For some kid, there may be some impairment in the protein metabolism. For some kid, there may be impairment in the carbohydrate metabolism. For some kid, there may be impairment in some other item. It's not same for, not everybody may not be having issue in gluten and casein. That's what we see. But as a primary level, you should follow gluten and casein. But along with that, many other things will be there. After interrogation only, we will come to know which one is very difficult to digest. We should work in that. We should make our body to digest that. Then only we will be able to withdraw from GFCF diet. So keep in mind, even if you are in GFCF diet, along with that, you should ask your health provider how I can consume, or my kid can consume this gluten and casein. How long I should maintain my diet? Absolutely. In my treatment protocol, usually I introduce gluten and casein in normal cases within 6 to 8 months I can start up. If you follow my dietary regulations for that 6 to 8 months, that is the time period that we follow. So accordingly, each and every kid is entirely different, not same. So please keep in mind, we should be able to take all the food habits. I am not saying which is very much harmful, like red chili. It is almost harmful to our body. Fried items, it is harmful. And if you say that it should be consumed in a regular point, it is not possible. The normal food items which everybody takes, our kid also should be able to take. Namaste.